We talked about this at the top of the program. The Morrison government under fire regarding the rollout of these vaccines, with just 1/3 of residential aged care and disability care facilities receiving vaccinations. Now, I can't make heads or tails of some of this because there's warring camps, isn't there? So to help us all out, I'm joined now from Canberra by infectious diseases physician and microbiologist at the Canberra Hospital, Professor Peter Collignon. Well, we're relying on you for some help here, Professor. 848 out of the 2,500 residents in these care homes, only that small amount, about a third, have received the initial doses. It's 6 weeks since we started the rollout. I know we want these vaccinations out quickly. We're being told that getting doses out of Europe, cancelling orders, withholding orders has been a real issue for the federal government. I know we're making it here now in Melbourne with CSL, but have I got it right?
Well, there's a number of phases that the vaccine was going to be rolled out. There's what they call the 1A phase, which were the frontline quarantine workers, the frontline healthcare workers dealing with COVID patients, and residents in healthcare, in aged care facilities, because they're either at the biggest risk or the most likely to get infected. Now, one would have thought by now, which is 6 weeks after the first vaccine's available, the vast majority of those people would have been vaccinated. Now, when they talk about residents as a percentage, rather than, I'm not sure what percentage of people in aged care homes have been vaccinated. It may be the bigger ones have had a higher proportion compared to the smaller one. That, figures I haven't seen. But we do need to get that group, everybody in the 1A group, that was including, for instance, in Queensland, the healthcare workers who are dealing with COVID patients. They need to at least have received their first vaccine. And there still appears a number that haven't, but I gather that'll all be fixed in the next week or two. The next big group, though, is this phase 1B group, which I might say I'm in because I work at a hospital, but not directly looking after COVID patients at the moment. And that's about 6 or 7 million people, because it's everybody over the age of 70. But a real factor in this is the supply of the vaccine. When they talk about 4 million doses or 4 million doses being given by the end of March, that was on the expectation that contracts would be fulfilled. But you might remember about 3 million doses of vaccine were not allowed to be supplied to Australia by the EU putting a barrier on that. Now, you can argue that may not have been all that unreasonable, because they've got uncontrolled COVID spread and we don't have it really any of any note. So we do have time on our side. But the real crunch is going to be how much vaccine is produced by CSL in Melbourne. Supposedly there'll be 1 million doses a week produced. And if there's 1 million doses a week produced, we should be vaccinating about 1 million people a week. But at the moment, my understanding is there's not quite that production yet. There's a couple of million doses in storage, but that's got to go through quality control and final approval. But I would think at this stage it'll ramp up fairly substantially over the next few weeks. And we will start seeing, 700,000, 1 million people a week vaccinated, because GPs will be able to get supply. The current problem is there's not enough supply. Now, some of the issues with the Pfizer vaccine, seems to me it was a communication issue between the Commonwealth and the states. The Commonwealth supposedly, or I understand, with the Pfizer vaccine in particular, where you've got to have another dose 3 weeks later, was keeping a supply for people to get a second dose, but so was some of the state governments. So there was less going out than should have been. Now, I hope that all gets sorted out. And there seems to be a mixture of fear and anger and a whole lot of things that come when you're in a bad situation or fearful situation, which COVID is, which actually means I think people say things that have not been helpful. But the bottom line is we're not going to be able to magic up 10 million supplies next week of Pfizer or anything else. We are constrained by what we can make in Australia currently with some importation. And I might say the most important to get people to get vaccinated in the next 3 months before winter starts, which is our next big risk period, is these people who are everybody over the age of 70 and those with risk factors. Because if we get something like
let me just jump in there. Let me just jump in there, because I couldn't agree more. I guess the dismay I have, the usual argy-bargy over health funding and health organisation that happens between the states and federal governments. I don't think people have got any truck with that at the moment. They want to see everybody work together. But there's been a lot of issue. I know we had it after the first week where we saw those numbers come out to say, X and Y were being vaccinated in New South Wales vis-a-vis Queensland, vis-a-vis Victoria. Those statistics dried up. That's because all the state premiers around the table at National Cabinet didn't want them released. Natasha Robinson in the Oz else today in the Australian newspaper. She says, you know, why aren't these statistics being made public? They should be made public, particularly in relation to how many of these frontline workers are being vaccinated and quarantined staff. Now, you're talking about the ramping up of the CSL manufacturing. I'd love to see a set of statistics every week that says in Australia we're bringing in this much vaccine, we're making this much in Australia, and here is how we're tracking against all those targets for your vulnerable groups, your over 70s out there in the community, and anybody else, health workers and others who need the vaccinations. Why are we so scared, all state governments, federal governments, about getting this transparent information out there? And then we've got a fair income debate about are they doing enough or not enough?
I fully agree. I think the more we're transparent with this, the better off we are, including, you know, everything to do with vaccine side effects and efficacy of all that, but particularly the numbers that are going out. We do need to know how many vaccines have been able to be imported, how many we're producing per week at CSL, how many are rolled out, and how many arms it's actually getting into versus, you know, what the state governments are delivering versus the private sector. Because we need also to make sure we're not wasting a whole lot of this stuff. These vaccines are in multi-dose vials, so there is some logistics in giving it. For instance, if you've got a 10-dose vial, you've got to have 10, 20, 30 people show up, not 25, 35, 45. Because otherwise you waste more of the vaccine. So there are a whole lot of issues that I fully agree. The more transparent we are, the better. And issues like the New South Wales government said, well, look, we only got delivered a whole lot of these vaccines a day or two ago. How can we expect to give them out? That's entirely appropriate as well. They're the sort of figures that ought to be available and transparent so people can actually see how we're tracking and really, look, is it the Commonwealth that, you know, needs to improve the game? Is it the state? Which states? Is it the GPs? Is it, you know, the states delivering the vaccine through their centres? I think that's really important that it's all transparent, not probably every day, but at least once a week. So I fully agree.
Once a week, couldn't agree more. It puts some pressure on the states that are not going to perform, and it rewards those that do. Professor Collignon, you've made sense of a very sort of complex couple of days. As always, thanks for your time.
Thank you.